Hello, my name is Marie with Allyant Medical Transportation. This video will walk you through your patient packet page by page so you know what each form means, what steps you need to take, and what may or may not apply to your situation. Some patients require insurance prior authorization. However, you do not. So you may see verbiage about prior authorization in your packet that I want to make sure is clear. You can pause this video at any time while reviewing your packet. Let's start with the welcome letter. The welcome letter is simply your welcome to Allyant Medical Transportation. It explains who we are, our contact numbers and info, and what is included in your packet. Here, there's nothing else you need to complete on this page. The medical release form allows Allyant to request medical records for your doctor's appointments. We use these records to check for stretcher transportation eligibility, submit to insurance if authorization is required, keep your transportation covered, and prevent interruptions in service. Please sign and date this form. Without this, we may not be able to help resolve insurance issues if they arise. The patient information form is very important. We need this information completed so we can coordinate your transportation safely or have information in the event of an emergency. Please fill in the blank for the spaces provided. Where it says special information, please put any information that would help the crew best assist you. For instance, if you had a right knee replacement and your right side is a bit weaker, that would be great to know. If you are unsure about anything, you can leave it blank and we will be sure to help you. The transportation agreement explains expectations for both you and Allyant. Important highlights include that you agree to be ready for pickup, notify us of any schedule changes or hospitalizations, and attend doctor's appointments when needed. We agreed to safe transportation, tracking insurance requirements, and help coordinating care. You will fill the information in at the top, and you will also print, sign, and date there at the bottom. The roles and responsibilities page is almost like a user-friendly guide for what we talked about in the agreement. This page explains how everyone works together: patients, families, and doctors. It also lists our contact information for any questions regarding this packet or paperwork needs. Feel free to reach out to Asia with the number here on the screen. This teamwork is what keeps transportation running smoothly. We are now on how to keep transportation covered. This page mainly applies to patients whose insurance requires documentation updates. Yours doesn't. However, insurance can change and requirements can switch, or you may even go to a different plan. Some insurance plans require updated, accurate records every 90 days. Even if your condition has not changed, your doctor, mainly your primary care, must still document that you need stretcher transportation. Insurance will accept documentation from any doctor, but most specialties are a bit resistant as they only focus on one particular area. If your insurance does not require prior authorization, this page is still helpful to understand the process, but a fewer steps may apply to you. What matters most is really just be honest with your doctor about your mobility, your weakness, any recent falls or recurring falls, dizziness, or pain. Your voice helps your doctors document correctly in the event that it is needed. Now, you may have one or two other pages on that left side, but we're going to move to the right side for just a moment. This is where you'll find resources for the doctor. Listen to me closely. Remember, you do not need prior authorization, so you will hold on to all of these documents for the doctor unless instructed otherwise. We will be sure to let you know of any changes that we see on our end. However, we are still sharing this information because it is still important for your doctor to chart an accurate assessment for eligibility. I know it's a lot, so stay with me. The most two important things here are no prior authorizations and hold on to all of the provider documents until instructed otherwise. Feel free to pause or replay the video at any point. Examples of verbiage is also for your doctor. It shows examples of language that we have seen historically meet insurance requirements. Again, nothing for you to complete here, but feel free to read it. You might see something that resonates with you, such as weakness or general fatigue after dialysis. That would be great to share with your nephrologist. Or maybe it's chronic back pain that you want to share with your primary care physician. Just bring it with you to your next doctor's appointment if we ask. This letter with the Allyant logo is for your doctor in the event requirements change. Hold on to it. Feel free to read it, but it essentially helps your doctor understand what insurance needs to see in the medical record. You do not need to fill anything out here. It is a letter from CMS. Some providers just want to see the requirements directly from the source, and we get it. So this is the exact reason why we added it, just that reason alone. It's just a reinforcement to everything we have discussed so far. Going back to the left side, you'll see something that says preparing for your transport. This page is for you. It gives tips for before, during, and after the trip. Comfort items like a blanket or pillows are encouraged. We don't want to just get you there safely. We want you to get you there in style. We are getting close to the end of this video and just want to share a few next steps. Your job is simply to attend appointments, communicate symptoms honestly with your providers, notify us after visits so we can request the records, and complete the packet. You can turn this in to one of the crew members of Allyant on the way to dialysis or head it back home. Lastly, if you have any questions regarding this packet, please call Asia. See you next time, and thank you for choosing Allyant Medical Transportation.